Welcome back to the Center for Sexual Health and Education. Today we're going to talk about how pregnancy and lactation or breastfeeding affects sex drive. It seems as though couples are very anxious to engage in sexual activity. They know the right time when they're trying to conceive. However, something happens when pregnancy starts that can change the sex life forever in relationships. Initially in the pregnancy, the woman feels sick and tired and has low sexual interest based on just feeling badly. So it's important for her partner to understand that. As the pregnancy progresses, there's more sexual interest in the middle of the pregnancy, and then again at the end there's a slowdown because of the weight of the baby, difficulty with positioning, no comfortable positions, although one of the recommended positions would be for the woman to lie on her left side and with her lower leg straight and her upper leg flexed, and that is a generally good position for sexual intercourse with pregnancy. The things that the guys don't like the most are that the vagina changes significantly. Early on, there's an abundant amount of lubrication and mucousy discharge as a consequence of all the hormones that are increasing in the body. So the women are wet all the time. Some guys find this a little bit concerning. Others don't mind it at all. The second is that the vagina changes from a nice rigid tube, which gives them more friction, to a more mushy and softer place, again secondary to all the hormones. So a lot of the men feel that this isn't so pleasurable to them, but seem to find it awkward to have this discussion with their partner. So I always try and initiate that conversation up front. After the baby's born, obviously fatigue, no sleep for the first 4 weeks, the hormone changes are all things that would make women not have any sexual interest. However, there are those that have a healthy sex life initially, right after delivery. It would be very important to advise contraceptives at that time for the couple. Then lactation, so breastfeeding. When breastfeeding is occurring, the estrogen level is down and the prolactin level, or the milk hormone, is up. So prolactin is actually inhibitory for sex drive, which means it doesn't make it a good thing. It blocks it. And estrogen is low, which means that the vagina can become dry, almost like that of a menopausal woman. So there's vaginal dryness, there's thinning of the tissue in the vulva and vagina, there's low sex drive from the high prolactin, there's fatigue, and all of these things make women not interested in having sex. So it's really important for the partner at this point to become very creative in their style to try and seduce the woman to engage in intercourse. A lot of times just explaining to women what's going on during this time makes them more willing to work through it. As far as the vaginal dryness, it is absolutely appropriate to use some estrogen vaginal cream in the vagina and vulva for the dryness if she's experiencing that while nursing. We do not use products like testosterone during pregnancy or lactation for risks to the fetus. So that's not even a discussion. After the pregnancy, there are also changes that occur in the woman's brain, which makes her more focused on the young and the needs of the child, and less so on the needs of the spouse. And so the spouse often becomes a little bit resentful of the newborn, whether they realize this or not, and they start wishing that they had the cuddling and caressing that the baby's receiving from the wife. So men need to sort of understand that their needs are being pushed aside just briefly, and that if they are a little bit more seductive with their spouse, they're liable to get the sexual gratification that they're looking for. And women need to understand what's happening with them so that they can work a little bit harder on their desire and interest and allow their partner some free time without the baby so that the intimacy in the relationship can continue. Some ideas for the men include anything that's relaxing for women, back rubs, a nice sensual bubble bath, not going straight for the breasts or the crotch when you're going to give your spouse a hug. So be more creative, think romantic, think relaxation. All of those things will drive your woman where you want her to be, and will make women more aware of the changes in her body so that she too can become part of the intimate couple. With that, I'll end this session. Center for Sexual Health and Education, Dr. Maureen Whalehan, and www.bestsexualadvice.com. Give us a call.